Patient is in the lateral decubitus position, while the right side is toward the roof and the left side is toward the floor. And here we can appreciate the right kidney, and this black area is the dilated calyces. So it is a hydronephrosis, and this dilated calyces are filled with the urine. And this area is the upper pole area, which is toward the liver, and this is the lower pole area, which is away from the liver. So these are the upper pole calyces, which are coming and then forming this is the minor and this is the major calyces, and this is the renal pelvis, and this is the lower pole calyces, minor calyces, and then the major calyces, and then the renal pelvis. But here we can appreciate that this is the one pathway and this is the another pathway, and here these are combined. So this is the duplex collecting system, which is incomplete. At the PUJ, both calyces with the renal pelvis combine together, and then they are showing the one ureter. So this is called the incomplete duplex collecting system. Only the duplication is present up to the renal pelvis level. And now we will talk about, look here, this dilated calyces have obscured the pyramid. Here should be the pyramid, and this is the renal cortex, smaller one is the renal cortex. So these dilated or hydronephrosis has reached to the level where the cortex seems to be thin. So there is a thinning of the cortex, and these dilated or hydronephrosis has caused the enlargement of the kidney. So I am going to measure the cortex. The maximum cortex here measures 7.3 millimeter. So this shows the thinning of the cortex. And when such a thing happens, because there is a thinning of cortex, so it means that this hydronephrosis has crossed the level of mild, also crossed the level of moderate. Now it is reaching to the severe hydronephrosis because there is a thinning of the cortex. So we can say that this patient is having moderate to severe hydronephrosis with cortical thinning. So when such thing is happened, it means there is an obstruction distal to this point. Away from this point, this is the level of pelvis ureteric junction. So now this is patient is in the lateral decubitus position. So I am going to ask the patient to adopt the supine position. Now patient is in a supine position and the probe is at the right flank region. So then press the probe so that we can displace the bowel gases. We can appreciate here, these are the bowel gases. First, give the graded compression so that this bowel loops can be displaced. So now when the bowel loops are displaced and the probe is in a longitudinal direction while it is having the 90-degree angle with the floor. So when we have such maneuver, we can appreciate this muscle, this one. This is the muscle fibers. This is the psoas major muscle. So we will find the psoas major muscle when the probe is in 90 degree to the floor and the patient is in the supine position. So when we have such maneuver, then just tilt the probe or angle the probe toward the left shoulder of the patient when we are going to examine the right ureter. So this is on the, I'm going also tilting the probe, angling it toward the shoulder of the patient. Then we can have the vessels and so when I have completely angled it, tilted toward the left shoulder and also the probe direction is anteriorly, we will see the vessels and also this is the ureter. How we can recognize if we are feeling difficulty for the color? The vessel will have taken the color while the ureter is not taken. So when we have adopted such maneuver, then we follow the ureter and is going downward toward the pelvis. So I am gradually compressing it and going downward. This is the ureter. It is too much dilated because there is severe hydronephrosis. Now we are going to trace the obstructive point. Here we can appreciate this echogenic area, this one. This is the stone which is trapped here and it is adherent to the wall of the ureter, this anterior wall of the ureter. This one is the stone which seems to be the wall of the ureter, but it is more bright than this wall. So this is a stone and this is the posterior shadowing. It is adherent to the anterior wall of the ureter. This is the one stone. I'm going to trace it. This is another stone. So this is the psoas major muscle, and then tilt the probe toward the left shoulder. We'll have the ureter. This is significantly dilated, so easily traceable. One stone is here and other stone is here, and this is the iliac vessels. So it is, look at the twinkle artifact also. This stone is rough, irregular, so it is giving twinkle artifact. Well, this is the vessel, so it is located at the crossing point of vessels. Look here, twinkle artifact. So two stones are present. One is this and one is this. This is at the level of crossing point and this is proximal to the crossing point of iliac vessels. Thank you very much.